most famous physical therapist on the internet.
Well, hi there, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
Together
therapist.
we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
How does inversion therapy or hanging help back pain? You're not talking about hanging from the neck, are you?
Bob, why, Bob? No, of course not. We're talking about the hanging,
With
the
their hands.
decompression, getting that spine to lengthen slightly to relax it, get that herniated disc back where it belongs. And the same thing happens with the inversion table, and we're going to explain.
We're going to go into details.
Yeah,
Explain this.
Exactly.
By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Also, go to bobandbrad.com. Right now, today, we are not giving away anything. We'll start a giveaway contest tomorrow again. You'll have to check out and see what it is.
Yep.
If you don't want to go to our website, you can go to Facebook. It'll be pinned to the top of the page, the contest. There's always, so it's good to join us there. Go to Twitter, Instagram, or TikTok if you want a 60-second version of our program.
Okay. So, Bob, we want to find out inversion therapy or the inversion table. We have one right here, a nice teeter one.
Yeah.
Hanging, which is you can hang, that also decompresses. So we're talking about traction, decompression. That's really the same thing.
Kind of lengthening the spine,
Right.
separating the vertebrae,
Right.
the bones that make up the
Exactly.
back.
And in these cases, we're using gravity to assist.
Right.
There used to be inversion or
There
traction tables.
There are traction tables.
Right, but I don't know if there's
You don't
around
see those
as-
anymore. You see the home units now that you can get.
Oh, right. Yep.
But
Yeah.
remember the Saunders traction table?
Sure. Yep. Okay, we've got a video on that as well. We're going to show you why right now, how it works and why it works. So we're going to look at, let's look at this model of the spine.
You want me to hold it, Brad?
Yep, I do. And so we're going to look right here. This is L3 and L4, and this red bulge here is a model of a herniated or bulging disc, where the disc is, the inside of the disc, which is like a fluid substance, is bulged out from mechanical forces, and this nerve right here is getting compressed, and that's going to create sciatica because the compression here, the irritation, is going to follow that nerve root all the way down into the leg.
This nerve is cut off for the model
Yeah.
here. Normally that nerve would go all the way
Right,
down.
as well as all these.
all these and form together,
Right.
the sciatic nerve.
So we want to put some traction or decompression using one of the the devices we're going to show why that
Well,
works.
why don't you show, do you want to show the traction on
Well,
here right
we
first?
can do it right now. For example, when you're on the inversion table or the hanging that pulls now this is exaggerated. This
Right.
doesn't happen near this to this degree.
that extent.
Right.
Right.
But this way you can understand it better. So here, as you hang on the inversion table or by the hanging handles, that pulls apart. Can you get that, Liz? And what that does is that allows space for that bulge to centralize or go back in where it's supposed to. And when that happens, we will need to keep it there so some scar tissue can form over that. And this happens over a period of days or weeks.
Right.
But that's the idea.
But the other thing that happens, Brad, is let's say you're not even having a disc problem.
Yep.
Let's say you're having a joint or facet problem.
Sure.
That's these joints right here. Each level has two facets on each side. When you pull apart, you see how that, now this
Gaps
is
them.
exaggeration too,
Right.
but you take pressure off. So if you're having like arthritis pain, it gives you some relief that
Right.
you're pulling apart,
Exactly.
taking the stress off of it.
Good
Now
point.
you're going to show with the vertebrae here.
Yep. So we're going to give you a little more dynamic model of it. So this represents one vertebra. This represents the one above it. And the green ball filled with a fluid, it's elastic. It's very similar
To a disc.
to a disc. And here we are. We're going to show, say we've got a bulging disc out right there. Now when that separates from the traction or the decompression, whoop, it pulls it right back in.
Right. And that's what we're hoping for.
Mhm, exactly.
So
Now, in either case, whether you're using an inversion table or you're hanging, the symptoms that you have, the pain, when you do it, it should feel good or very good. If it increases pain, you do not want to use either one.
Right.
I've used both on myself. I've had an inversion table for about 2 years at my house. I do the hanging right now. It's a little more convenient. But the inversion table was helpful for me when I used it.
Yeah, and I hang. I like to like set my timer, especially when I'm working at the computer. Really don't have back pain right now, but I don't want to have back pain
Sure,
either.
maintenance.
And whenever I do the hanging, I get a little bit of clicking in my back, like it actually
crepitus.
crepitus, or and it feels better.
Yep,
I mean,
kind of cracked your
yeah,
back.
kind of crack my back.
Let's show the hanging first, and then
sure.
we'll come back. So we're going to show you a brief demonstration on how you do it. The hanging is probably a little more simple than
Right.
the
Now you
inversion
can
table.
hang on a bar, a pull-up bar,
Sure.
anything that you have. We have the hanging handles that you actually get a clip that goes into the stud.
Yep.
I mean, an anchor.
Anchor.
An
Yeah.
anchor that goes into the stud, and then you clip onto it. These clip off real easy if you want to get them out of the way, and you can actually use them with resistance bands
Right.
too if you want to.
Exercise.
But I go ahead and just grab on, and you can do partial weight. So I maybe leave my feet on the ground,
Yep.
and but I'm still getting some pretty good. These are good for the shoulder, by the way, too.
Right. There's a whole book written
Yeah.
on that.
So, and then eventually you might actually take even less weight on your feet, and then eventually you might even lift your feet up,
Sure.
and you're really getting some relaxation then.
Stay there once, Bob, because I'm going to
Sure.
show you one thing. Bring your feet out once, down. Yeah, don't show off too much. But what I want to do is, I flatten my back here into it, and that really feels good.
Oh yeah, it does.
Yeah, it gives it a little extra stretch.
So you're doing a pelvic tilt basically
Right.
while you're in this position. You actually can do a little bit of twisting too,
Yep.
Brad. I find this to actually feel good sometimes, just gently twisting
Gently,
back
yep.
and forth.
Again, when you do this, it should feel good. You're not going to
Right.
do it if if your back is painful with it. It should feel very good, and that's exactly why we're doing these extra motions. 'Cause
Yeah,
it
I
feels
like this
better.
because basically my home is my office right now,
Sure.
and so again, if you do a lot of seated activities,
Yep.
you can just take the break, and it kind of revives you
Right.
and gets you back focused back on work, but it also good for your back.
Right. Yep. So that's hanging for the back. Now we'll go to the teeter.
Sure.
So-
So this is so interesting that I thought this was the perfect name for this because you kind of like a teeter totter,
Right. Yep.
and it turns out the guy who invented his name is Teeter.
I
So-
don't think he invented inversion tables per
No,
se.
no.
But he did invent this. And there are other inversion tables that work fine. We like these. They're very well quality built, and we feel comfortable promoting
Yeah,
it to
good
people.
price.
Yep.
Good price.
So I'm going to lock my ankles in here. It's important that you feel comfortable and you have a good device that locks your ankles in so you don't tip over backwards. And once you have it adjusted right, we do have a video that shows in detail how to use one of these. We're not going to do it for this video. I have this adjusted, so I just lift my arms up. Now, in either case, whether you're on the inversion table or hanging, you have to learn how to relax your core muscles. And
Yeah, you're not going to get the back to decompress as well if you're tightening up.
right, so
You're going to prevent it from happening.
I always go back now. I'm not fully inverted, and I never do fully invert. Some people do. I think it's a little aggressive. That's up to you.
This is as far as you go, right, Brad?
Yeah, this is about 60 degrees. I think this is a little more than what I used to go. But right now, I'm allowing my stomach to relax, and I can feel my back getting that traction or decompression on it as I relax those muscles. It feels good. I'm not going to hang out here for 10 minutes the first time for sure. 1 to 2 minutes to see how it goes. The first time I did this, I hung out for 5 minutes and I had a headache for the rest of the day.
So yeah, beware if you're just starting this. There's some precautions.
Right.
I mean,
Yep.
blood pressure precautions, and you probably want to get it approved by your doctor.
If you've got glaucoma,
Yeah.
blood pressure problems, cardiac problems, check with your doctor because
Right.
there's a good chance he's going to say it's not for you. Then you can do the hanging.
Sure.
So, very nice device.
Yeah.
I feel taller too, Bob.
Yeah, you're almost as tall as me. So
All right. Well, I hope we cleared that up, and and you can find out if these are for you and help your back out.
yeah, thanks for watching, folks.
Ooh.